With the growing consciousness towards diversity and representation in psychology, now more than ever, it is important to consider the history and contributions of individuals that have been understudied within the field. Dr. Shoma Morita represents one of those pivotal figures, especially for the way in which he developed and adapted therapeutic principles of clinical psychology for the Japanese context. Morita was born in 1874 on Shikoku Island off the southwestern coast of Japan. He was the oldest child of Masafumi and Kame Shoma, perhaps foreshadowing his future work in research. Even as a child, Morita was described as having a strange interest in mortality and suffered from various ailments with strong somatic components. He grew up during the Meiji period, a time of major change for the Japanese people, as they were forced to reject their historical culture and traditions in favor of Western science, philosophy, and religion. Subsequently, reflective of the larger socio-political transitions of the Meiji period, Morita's academic and social upbringing represented a combination of both Eastern and Western influences. In 1902, Morita completed his medical degree in psychiatry at the University of Tokyo, formerly known as Tokyo Imperial University, under the tutelage of Dr. Shozo Kure. In many ways, together, Kure and Morita would become the first generation of modern psychiatrists in Japan. After graduation, Morita assumed a professorship in medicine at GK Medical School in Tokyo, where he later be promoted to academic department chair. During the course of Morita's graduate education and the beginning of his career as a psychiatrist, psychoanalysis rose in popularity and established itself as the preeminent theory for Japanese psychiatry, with the increased influx of German texts that became available during the Meiji period. Although Morita remained engaged and informed in current psychiatric discourse by writing reflective critiques about the field, unlike many of his Japanese peers and contemporaries, Morita never fully adopted Western approaches to mental health. A majority of Morita's work centered on the treatment of individuals diagnosed with Shinkeishitsu, an outdated term that Morita used to describe anxiety-related symptomology combined with a sensitive temperament or disposition. Over the span of approximately 15 years, Morita's clinical work with people affected by Shinkeishitsu informed and helped him develop his self-titled intervention system, Morita Therapy. In many senses, Morita Therapy developed from a theory of consciousness that challenged the psychoanalytic dogma prevalent of the time. Contrasting Sigmund Freud, Morita did not believe that the unconsciousness resided within the individual. More comparable to Carl Jung, Morita argued that the unconscious was a collective experience outside of the self. However, instead of being centered on one's relationship with others, Morita conjectured that the unconscious involved one's connection with the environment, potentially related to Morita's beliefs about the importance of nature from Zen Buddhism. Thus, the primary goal of Morita Therapy is to help the individual rekindle their connection with nature. In doing so, the person will not only develop a more authentic sense of self, but come to understand and accept that there exist certain laws within nature that cannot be changed. Specifically, for individuals diagnosed with Shinkeishitsu or anxiety-related issues, emotions constitute one of those immutable laws of nature in that it is natural or normal for humans to feel anxiety. In turn, rather than expect to change or completely cure the feelings of anxiety, the Morita therapist will help the person come to terms with their concerns as a part of their communal self with nature. The structure of Morita therapy follows a dynamic and sequential format intended to be implemented in residential settings. The 4 stages of therapies include absolute bed rest, light occupational therapy, heavy occupational therapy, and complex activities. Progressively, the intervention is designed to guide the individual from passive to active behavior and from seclusion to reintegration with the outside world. The first stage of Morita therapy, absolute rest, involves seclusion from the outside world and supine behavior. The patient is expected to lay in bed for 4 to 7 days as a means to remove him or her from external stimuli of the outside world, including technology, work, and social interactions. The only time the patient is recommended to leave the bed is to use the bathroom. The client is prepared to progress onto the second stage of Morita therapy once he or she communicates restlessness and a desire for environmental engagement. The second stage, light occupational therapy, involves an incremental increase in activity level and exposure to the environment. The client completes simple, non-strenuous tasks in silence for 3 to 7 days. At this point of therapy, the patient is expected to go outside of themselves and explore the immediate environment around their house as well as their sense of self. Journaling, for example, is a primary activity that clients are recommended to engage in during the stage, as it can be done outside the house and be used as a means to reflect and expand one's identity. The third stage of Morita therapy, heavy occupational therapy, requires the client to engage in more active types of behavior and start developing into the primary agent of change. Notably, the client learns techniques from other therapy programs such as stretching and physical therapy that they can integrate into their daily living even after the completion of treatment. In addition to more strenuous and active physical activity, the therapist also encourages the patient to cultivate their creativity with art. The stage of heavy occupational therapy continues on for 3 to 7 days and seeks to bolster the patient's growing sense of self. The fourth and final stage, complex activity, involves reintegrating the new version of the self into the constraints of society over the course of 1 to 2 weeks. As a culmination of the previous stages, the patient is expected to apply what they have learned in terms of physical activity and the relationship between the self and the natural world to aid in this process. Inherent within the Morita therapy model, but particularly in this stage, is the understanding that the patient may continue to experience difficulties as part of their natural existence, and so the patient is encouraged to refer back to their materials and seek counseling to develop additional coping skills. In all, while he may never be fully credited for the impact of his work, Morita connects to important parts of the nomological net of psychology. Morita's notion of a self beyond the individual not only represented a radical shift from the teaching of psychoanalysts like Freud, but could be seen as one of the theoretical forefathers to Bronfenbrenner's ecological system theory. Moreover, the principle of acceptance and the incorporation of practices like meditation and the arts in Morita therapy are potentially more relevant now in therapy discourse than they ever have been, with the development of acceptance and commitment therapy and the renewed interest in complementary and alternative treatments.